My name is Thilly Mokete. I am going to be handling again stroke and mental health. So I'm positive that it would be appropriate for us to maybe go back and recap a little from what we were discussing the last time. We spoke about stroke and mental health, how stroke affects your or my mental health. And the last time we spoke about all the conditions that would surface because of stroke, or that would show because of stroke. We said depression was one of them. And when people have had a stroke and experience depression, it is one of those things that we should be expecting from them. It is a condition where their mood is low, where they have got poverty in concentrating, where they have got a decreased energy level or drive, and their sleep patterns change. Apart from depression, they become very anxious because they don't know what's going to happen next. They might experience stroke for the second time or the third time. They don't know as to whether they will live or not live, or what is going to happen after the stroke. They are always anxious. They are always tired. They experience sleep disturbances. So we also looked at the factors that affect mental health after the stroke, and we looked at age. We discussed age as a very important factor because the younger you are and you experience stroke, the more anxious and the more troubled you will feel, because you ask yourself, am I going to live up to my old age? What's going to happen? I'm still young and I still have life to live hereafter. Am I going to be able to look after my young ones if you already have a family? Am I going to continue to work in the situation that I am? We looked at social support. If people have got social support, a patient, for an example, and he or him has had a stroke, the better the outcome of the stroke, the faster the recovery. Because if you don't have family support or support from clinicians, from occupational therapists, from your physicians, from your physiotherapists, then one ends up not recovering as much as they would love to, or as fast as they would like to look forward to. Return to work, which is critical, especially the younger people that get stroke. It's important that they are rehabilitated faster, because the faster they are rehabilitated, the better the chances of recovery and going back to work. Remember, we don't just go to work, but we earn a living or an income, and you plan so many other things. And you might be lucky and build wealth from there. So all the activities that one engages in and one gets economically vibrant, economically active, are actually very, very important. So even post-stroke, they need to continue earning a living. So returning to work is very, very much important. Then we looked at the reciprocal effects of stroke. Remember that people, when they have had a stroke, they need somebody especially after discharge from hospital, somebody to look after them. Like if it's family members, then it requires that perhaps some of the people in the family, like a mother, an aunt, if they are there, or a sister or a brother, to look after the survivor of the stroke. Depending on the severity of the stroke, an individual might need to be, to be assisted as far as walking is concerned, as far as sitting in a chair or standing up from a chair, as far as getting out of bed, being fed, being assisted with personal hygiene, bathing, brushing one's teeth, and quite a number of things, like being taken to the hospital or rehabilitation center for appointments, being brought back. Some cannot even drive. So it is a mission. And with the support of the family, a lot of people do survive and do actually improve and get rehabilitated. And that reliance or dependence on the family or on the people in the carers in the rehabilitation center can actually affect the people that are assisting a stroke survivor quite a lot. It gets heavy on them. They might not be ready to accept a person with such a condition, with a stroke, for instance, and that risks depression coming on top of the family or the carers, depending on who's looking after them. So the well-being of the family, as well as the well-being of the stroke survivor, will depend on how they interrelate. And again, it will depend on the severity of the stroke survivor. There will be those stroke survivors that do just experience a transient stroke, one that comes and goes immediately, where the person is not even sure of what happened, didn't experience or had effects of a serious stroke, and they are able to continue with their work. They can still concentrate. They are not relying 100% on the family or the carers. Patrick, I need slide number 4. Let's see. Okay, the physical effects of stroke. We looking at those, physical effects that where someone might even change their physical appearance. And this is important because an individual will be looking at himself or herself in the mirror and they'll be seeing somebody different. Maybe there is drooping of the face on one side, or there is partial sense of sight where they can't see properly, or there is inability to speak. They want to articulate something, but they are unable to do that. As a result, they lose confidence in themselves because they're saying, oh, I'm appearing like this. What will people say? Or people are looking at me, or maybe immediate family members. They find it difficult to accept this kind of appearance in front of them, or the client himself or herself. And there will be paralysis depending on the severity of the stroke, where an individual is sitting in a wheelchair, has to be assisted to get in and out of the wheelchair. An arm or a leg that is not working could cause problems to this person. They might become very anxious on how am I going to drive? How am I going to perform my duties? How am I going to do this or that? Because remember, we use all our hands and feet and legs like we grew up, like you've been alive and being able to move from point A to Z. And now all of a sudden, we have to be wheeled or we have to be pushed or have to be assisted. Loss of job or wealth or a home, a house, maybe family. People get divorced after this terrible stroke. People get put into a home and they don't never see their family members anymore. Friends friends that are like very critical that you maybe grew up with or you're working with or you've been working with, and all of a sudden you cannot see them anymore, and they also play a very important role. So in conclusion, let's look at stroke as a condition that affects both adults and young people. I've come across people in very tender ages of 19, 20, 25, 30 that have had strokes. So because stroke affects any age group, we need to assist our people as much as we can. And when we help them, let's keep in mind that we create a routine for different activities, be it getting out of bed, be it sitting at the table for lunch, be it, attending to their personal hygiene and grooming, be it wheeling somebody out into the garden or around the block for an exercise. It's important again that we have an open communication with them, not plan things around them without them, especially if they are able to understand and have a meaningful input into their own life. So let's speak to them and not treat them like children. We need to honor or respect appointments. If a doctor or an occupational therapist or a nutritionist says, we will see you, ma'am, on the 11th of November, let's see to it that we also jot down that appointment, and then we don't like, oh, I forgot about it, because it's important, remember, to the stroke survivor to be there at the venue when the doctor is there, or the group is there, the support group, or the physiotherapist or the psychologist. It is critical that they honor the appointments so that at the same time we feel involved, and the client also feel that I am being supported. Lastly, we should encourage independence, because the stroke survivor who is just sitting there without not even lifting a finger, to him or to her in the beginning could be important, but as the client attends different appointments with different healthcarers, there is or there will be improvement, recovery that is expected from that person. But if we are all the time on top of the client doing this, we don't even want him to stand or to write down or to wipe his own face or nose if they can, then we are sort of assisting him to regress instead of to improve and have a meaningful life with whatever that amount of energy or brain functioning that is remaining. We need to improve it and see to it that he gets better every day. I thank you. This is the end of our presentation today.